welcome everyone. We're really grateful to our whole community, both for signing the community pledge and for honoring the pledge. And our whole community together has kept our children safely in person in school since September 8th. We know that many public schools didn't begin in-person learning until the first or second week of October. And in many cases, schools surrounding ours have already closed either grade levels, classes, or whole schools. I feel very fortunate that we've been able to create a safe environment for your children. And tonight you're going to hear from our medical staff about the many ways that they've been working hard to keep our children healthy and safe in school. You saw some of this in our town hall in September. Many things have been added, many processes, protocols, safety measures have been added to what we started in September. And I'd like to first introduce Bill Brantmeyer, our head of safety and health.
Hey, Bill. Sorry, Bill, you have to unmute yourself, please.
Is that better?
That's wonderful. Thank you.
Okay. You may have heard on the news recently about in Ulster County, there have been a couple of schools now that have had to pivot to remote learning. And the reason for that is because of the way the physical plants, the structures of the schools are set up. If we can go to the first slide there. I just sort of pulled a random picture of a typical school. Many of them look like this. They're designed to be secure. They have generally one main entrance and they're one large building. They're also designed to efficiently hold large numbers of students at one time. They're not designed for the sort of threats that we're facing right now with a pandemic, with a virus. If we can go to the next slide. The buildings themselves have lots of classes. The bathrooms are set up in a way that they can accommodate a lot of students into each lavatory. I actually looked up the code for that in New York, and they require one lavatory for every 50 students. And so you can imagine that all of these kids within a confined space and having to share minimal numbers of bathrooms, how that creates difficulty with keeping cohorts separate. And so what happens with these schools, if they get one positive case, they begin their contact tracing, which we're going to talk about in a little bit. And because of the way the physical plant is set up, that one student may have contact with 20, 30 other students, 20 staff. It's just because of the way that they're set up. In our school, we have, actually I have 12 bathrooms here. I recounted them. We actually have 13. Things like that, they seem small, but they make a big difference as far as keeping the cohorts separate. If we can go to the next slide. So I kind of wanted to just let you all know that when the big brick and mortar schools have a case and they have to pivot to remote, it's because of the way the physical plant is set up. And I want to sort of contrast that with how things are structured here. Next slide, please. So our mitigation, and I just wanted to put this up here so everybody's clear on what we mean by that. We're working to try to make things less severe or serious, try to lessen the challenges that we have with the virus. It's not going to completely negate them. We're trying to minimize them as much as possible. If we could switch to the next. So the first sort of perimeter that we have in the school from trying to keep the virus out is that outside perimeter that you all are familiar with, that you walk up to with your children, and your children then come inside the gate and go to their classes. As you can see here, we have the two gates that the students and staff come through. The staff actually only come through gate 1. And in the mornings before students arrive, they usually get there around 8 o'clock. They all have done their screening, we get their temperatures, and they go on to their class just like the students do. And then you can see off to the side, we have that one delivery gate. Any deliveries that we get, they're not allowed to come into the building. They leave them on the bench there on the outside. So that's our first perimeter. If we can switch to the next, please. The next perimeter from there are the buildings themselves. And as you can see, we have the main building, the nest, the upper school, music, and the yurt off to the side. Each one of those buildings, only the classes that are in those buildings and only the people within those classes are allowed in those particular buildings. Carrie and myself are sort of the gophers for the school. So anybody that needs copies or needs anything from the office, we're the ones that deliver it to the different buildings. The teachers aren't, I don't think anybody from the upper school has ever been in the main building, and vice versa. Same with the nest. So that's one of the ways that we keep our perimeter secure. Next slide. And then within each of those buildings, we have the classrooms themselves. And none of this is to scale, everyone. This is just to help demonstrate a point. The ones that have the dotted lines around them, that represents the fact that they're on a lower floor. And when you look at the three buildings here, the main buildings, each one of those classrooms has its own entrance and exit. There's just one exception, which is the first grade and the kindergarten. They do share an entrance and exit on the side porch. But aside from that, every single one of these classrooms has their own way for the students and the teachers to come in and out. Next slide, please. And like I was showing in the how they're isolated, I just want to give, we talked about some of this in the town halls previously, all the upgrades that were done. This just represents how, like, for example, our heating and cooling systems, there is a individual heating cooling system for every single classroom. There isn't a central system like a lot of the big district schools have. So the air also is kept within those classrooms. It's not exchanged between the different classrooms. Next slide, please. And then our next perimeter from that is the classrooms themselves. So those circles that we showed for kindergarten, first, nest, so forth. This represents one of those classrooms. Only the students are allowed inside those classrooms and the teachers. And with the exception of Carrie and I, who are coming in and out delivering things, only those students and teachers are allowed in and out of that classroom. So that's another perimeter and layer of protection for the kids and staff that are inside. And the next slide. Here, you know, I've worked out nice that I was using circles for the classroom because there's the yurt. Because we had a larger class with a kindergarten, we invested in a yurt so that we had enough square footage for the size of the class that we had. We felt we had too many students, so we expanded that class into another classroom so that we could keep our perimeters intact. Next. And then finally, there's the personal perimeter. And this is probably, well, they're all important, but this one's an especially important one, is that each person creates essentially their own perimeter where they're wearing a mask. They're maintaining physical distance that I like to use rather than social distance. And they're washing their hands frequently, especially when they're transitioning from one class or one area to another. So this is a way that each of us can create a personal perimeter. Next slide, please. And here's one of the examples of the hand washing stations outside. We have quite a few of these exterior hand washing stations. I think, do we have the video, Carrie, that we're gonna show? I don't know if all of you got a chance to see this. This is with Daisy, who has become a bit of a star at school. That we showed the kids that it was around hand hygiene.
Bill, do you want to share what the kindergartners told their parents about Daisy? That a sick bear came to school?
Oh, I didn't hear that.
So Susan, I'm sorry, I had started the video. Can you ask that question after, or do you want to ask it before?
Once you meet Daisy the bear, you'll know when a little kindergartner went home and said, "Mommy, a very sick bear came to our class today." And we wanted you to know who the sick bear was.
And if I may too, before the video starts, it wasn't reflected in this video because it was National Hand Washing Day. But when we were teaching the class, if you notice, Daisy has a mask that's below her chin. What I would do is I would show the difference between when she sneezed without the mask and then when she sneezed with the mask. So the class that we actually taught in the different grade groups was about both hand washing or hand hygiene and respiratory hygiene.
Ready for video?
Yes.
Great.
I'm not hearing sound.
I don't hear any sound. You might have to share with sound.
Sorry, guys. All right, let me get that queued up again. I'm going to stop my screen sharing for a moment.
Can never get enough of Daisy.
No, Daisy's great. Let me try that again. Okay, this time we got it.
Hello everyone, my name is Bill and this is Daisy, and today is Global Hand Washing Day. Daisy here has a superpower. She can sneeze. Are you ready, Daisy? Bless you. So Daisy just sneezed on my hand, and this is just one reason why hand washing is so important. Daisy just accidentally sneezed on my hand, and that's okay. I just need to wash them. And being that it's Global Hand Washing Day, I'm going to show you how to do it correctly. So I'm going to start, I have to lean down a little bit here. I'm going to start by getting a little water on my hands. I'm going to put some soap on them, rubbing the fronts of my hands, in between my fingers, on the backs of my hands. And then this is something that's really important to do as well, which is to sort of rub each one of your nail beds, get under the fingernails a little bit. And once I get them all well lathered, I'm going to put them back under the water again, rinsing all the soap off. Give them a quick shake over the sink to get some of the excess water off, and grab a couple of paper towels. And I'm going to dry my hands. And that is how you end up with clean hands.
So with that, I'm going to turn it over to David, our nurse practitioner, and he's going to talk about some of the medical aspects and protocols that we have in place here.
Thank you very much, Bill. I cannot see the presentation. Oh, there we go. If we can, I just wanted to start off and discuss when a student or staff will test positive. There's a whole host of things that kind of kick in. I just need to premise when a student is ill, the first thing you really want to do is to contact our health department. either by email or by phone. Bill and I monitor the email continuously, so it doesn't matter what time you do contact us, but try to contact us as soon as possible, and definitely within 24 hours. I think that would behoove us all, because as I move forward and talk about the New York State decision flow sheets for illness, it'll make a little bit more sense. So, okay, so really please try not to contact the nurse's office or the health office. Don't send a message through the teaching staff or other non-faculty. The reason for that is for confidentiality. We want to keep health information confidential and secure, and it helps with optimizing communication. Okay, so we just want to make sure we get the right information to you as soon as possible so that you can make the best informed decisions that you can. Okay, all right, so New York State has produced these flow sheets, and all this information is going to be on the website now. And at the end of the presentation, we'll talk to you and show you where to get that information. But what I'm going to talk to is about if your student is or your child is ill, and what do you do? Okay, and what we've done is we've actually layered this information and embedded it into the daily health screen. So by making those decisions on the health screen, you're actually going through this flow system, and I'm going to just break it down really simply for you so that you can get a feel for it. Okay, so so this is the one for can your child go to school? We have another one which we'll talk about a little in a few minutes. Can my child return to school today? Okay, so let's go through the one about can they attend? All right, so and I'm just going to walk through. So the top left box is have they tested positive within the last 10 days? If they have done that, then they really can't. They really need to be quarantined until we get a negative a result, or if the Department of Health has lifted that quarantine. Okay, so that's the first test. If they haven't tested positive, and now we move into the second category. So we're looking at travel. Okay, so in the last 14 days, has the student traveled, to a designated area that's that has high incidence of COVID, or a travel ban, or etc. Okay, so have they traveled? Yes or no? If they have, then they cannot go. Okay, they need to quarantine for 14 days. Okay. And then we're moving over to, so most of us are getting into this first column and second column, right? So this is where the health screen kind of picks up about symptomatology. Now, I know people know in the press that some people can be asymptomatic, but this is an effort, just like Bill said, to create layers of security. Yeah, sure. Is this possible that this could squeak through? Yeah, and that's why we have the multiple layers of protection. So so if your child's ill, sick, these are the symptoms. I'm not going to go through them, individually, because you all can read that. What does come up is difficulty with nasal congestion. Sometimes they have a sore throat or are tired. Unfortunately, the Department of Health has kind of not given us too much wiggle room with these symptoms. They are very kind of vague, and that's kind of what's going on with COVID. So the only exception to the rule is if these symptoms are associated with chronic or long-term, well-established known medical issues, like they have allergies every fall, or they have some kind of esophageal issue that they're refluxing, and that's why they have a sore throat. They have like a sour hiccups all the time, and that's documented well by their primary care provider. Then we can actually forego some of those symptoms. But whenever possible, if your child's ill, we really want you to take a knee. Okay. So yes, so if they're coming up with these symptoms, we're going to go right down to this lower chart and say that they cannot go to school. And what happens then is you really want to contact the nurse toot suite and share that information with them. The nurse may follow up with that if in the event that you didn't contact the nurse, they'll contact you regarding an absence. And we want to explore, you know, the etiology of the cause of maybe their absence. If it was illness related, then we might want to, we're going to encourage you to really move forward to have the illness kind of assessed by your primary care provider. Okay, so, and probably we would strongly encourage you to get some kind of COVID testing, because that, as we roll forward into the next slide, that's what's going to be really kind of required, some documentation that really is required. Okay, so as you move into the healthcare checkup, okay, if the healthcare provider recommends a COVID test, then they would be tested. Now, there are a variety of different tests, and your healthcare provider can share with you the different types. But we have been advised that the rapid test is an acceptable test to be performed, and that can be done relatively quickly, about 15 to 20 minutes. And that could be the most expeditious way to have your child return to the campus. So the thing is about finding availability of those tests, and it is becoming much more available. There's another test it's called a PCR test, and that can be done through nasal or oral saliva, and that can take anywhere between 2 to 7 days. And that's really where the big rub is, because we can't have them come back to school unless we get a negative result or a diagnosis of a definitive medical issue that's causing those symptoms. So they have a stuffy nose. They can't the doctor cannot document viral illness, you know, or a viral upper respiratory infection. It needs to be a specific diagnosis, like chronic, you know, seasonal allergies or strep throat. You know, it has to be really definitive. Okay, so just coming back here, so if we're positive, we're going to have to do all this quarantining and timing out. If it's a negative, if your child symptoms are getting better, okay, they're not getting worse, but they're getting better, they can come on back, and if they've been fever-free for 24 hours. Okay, so that's what happens when we're negative. Okay, the only other exception is what I told you before is this next little box, the third box from the left, is where the healthcare provider will provide a diagnosis, a definitive diagnosis, or explains the etiology for the symptoms and that they are not having a contagious illness. Okay. And we can I'm sure we'll have some questions about that maybe a little bit later. All right. So I think that's it. That's pretty much kind of like you know, how that works. Now I'm going to pass it back over to Bill, who's going to expand the concept of contact tracing and really try to make it, you know, this is where the real meat of this presentation is really trying to keep everybody in their kind of protective areas and do the right thing when we find out that there are issues. Okay, Bill.
Thanks, David. Yeah, so I kind of want to walk you through some scenarios of what would happen if we ended up with a positive case somewhere in the school. And I want you to kind of think back about how I showed all the different layers of protection that we have and what that means now and how that actually helps protect the school in general. Next slide, please. So the first thing I want to kind of, and this define for you, is what constitutes an exposure. This was recently modified by the CDC. The modification was due to one case that they had in a prison with a prison guard who was not with an infected individual for 15 minutes total. He met with this individual for brief periods of time over a 24-hour period and ended up becoming positive himself. And so what they've done is they've changed the criteria to a cumulative total of 15 minutes over a 24-hour period rather than one 15-minute period. Next slide, please. So the way that we sort of categorize the levels of risk, and I've listed this from highest to lowest, and these sort of generational ways of describing are used in different ways in epidemiology. This really was from the H1N1 pandemic. We're using patient 0 as anybody that's tested positive. They obviously must quarantine. Generation 1 is anyone that's had close contact with patient 0. This will all make sense once we go to the next slides. Anyone that's had close contact with patient 0 must also quarantine and get tested. Then generation 2 is anybody that's had close contact with generation 1. So let's say someone ends up positive, and they have someone that they've been in contact with, and then that generation 2 person has been in contact with a person who was with a generation 0 person. They do not need to quarantine, but it's strongly recommended, and they should also get tested. And then third generation is someone who's been in contact with the second generation person. They do not require quarantine, but testing is advised. And again, this will make sense here in a little bit. So again, I tried to do away with having the actual classes like I did in the beginning, showing the perimeters, because I don't want to stigmatize any particular class by saying, let's say we have a case here. So I've kept it sort of vague about the classes. If we had a positive case reflected by the, or represented by the red dot there in that particular class, that student would need to quarantine. And next slide. And that class, and only that class, would go remote for the 14 days. And the reason for that is just what we explained in the beginning, because there is no cross-contamination. These students aren't moving from one class to another. They're staying isolated from one another. So that's what the real advantage in our school, because we're an open campus, we have all the individual entrances and exits, we have different bathrooms for everybody. We feel reasonably sure if we get one case that is an isolated case or circumstance for that class. Next slide, please. But let's say we end up getting another positive in a class nearby. That's now starting to tell us, we might have an issue that either we have some cross-contamination going on, or maybe they were visiting outside of school, or it might just have been happenstance that we had another person test positive within that building. That then would mean that class would also have to go remote. Now, at this point, we would also be considering, because we have 2 positives within one building, depending on the circumstances, we may end up having that entire building pivot to remote learning, which is reflected in the next slide. So in this case, then, even though we didn't have a positive in that third classroom, because we had 2 positives in the building, and we can't find any real reasons that we can put a finger on when we start doing the contract tracing with the Department of Health, then we would shut that, or turn that whole building into a remote learning, pivot to a remote learning. Now, there are other issues that come up around contact tracing, which is the next slide, please. If we end up, I'm going to minimize the screen here, the video, so I can, next slide, please. So let's say we have that same individual that tested positive in the block A2, I'm just going to use that, has a sibling that is over in another building. Because they live in the house together and one of them has tested positive, that student would need to quarantine. Go ahead to the next slide, please. The class itself, until that particular student was, that student would need to quarantine and they would need to get tested. We would not have to have that class go to remote just yet, because we're waiting to see if that student ends up positive. If they do end up positive, I think I have the next slide. Oh, I'm sorry, I don't. So go back, please, if you could. Sorry about that. If that student does end up positive, just like the other class, then that class would then also have to go remote. Okay. So this is where sort of the second generation stuff comes in. Now that the students that are in that class with the sibling, they didn't have direct exposure to the student who tested positive. So they're considered second generation. Next slide, please. And let's say that someone that was in that class that we were monitoring has a sibling that's in another building. They are considered third generation because they haven't had direct exposure. They've only had exposure to someone who has been with the person who tested positive. Okay. So that's how the contact tracing works. We are, I'm going to bring the screen back up again here. We have to send a report in every morning by 10 o'clock to the County Department of Health to let them know if we have any symptomatic children. The reason that they want that early is that they will, if we end up with a positive case, they actually begin the contact tracing. They'll start reaching out to the family, they'll reach out to the school, and they'll start sharing information, or at least working through the information to see who might have had contact with that person. The other thing that you all should know that's important is that if someone from a class that we've indicated to the Department of Health as having symptoms and is going in to get a test, the Department of Health actually gets those results oftentimes before we do. So if they get a negative on the test, they already know that. And we don't even have to report that. So they'll already know that this person tested negative and everything's okay. So with this contact tracing, we're able to keep really close tabs on what's going on within the school. The area that we don't have control over is what happens outside of the school. And that's really what we wanted to focus on this evening. We wanted to run through all this so you kind of understood what was going on inside here and how careful we're being. We can't control what happens outside though, and that's on all of you. And that's why that pledge is there. And Carrie and David are going to talk a little bit about that. And so I'll turn it over. Who wants to begin?
I'm happy to start. I just wanted to hello everybody. First of all, thank you all so much for being here tonight. You know, a dark and stormy Wednesday night. We're very, very happy that you could all join us. I'm going to share my screen again, and I just want to show you a couple of resources that we have and some updates that we made on our website recently. So what you should be seeing right now is the homepage for our website. And if you notice here on the top bar, it says HMS COVID-19 policies and practices. We used to have our opening plan there. And what we, as a staff, talked about is it was great. You know, we got a lot of plans ready for us to open safely, but so many things have changed and modified, and guidance has been changing. So we're trying to keep up with that and keep it in a very easy way for you to follow. So if you just press here where it says view here, this new page will come up. And a lot of this is what has already been covered in our presentation. But one thing that Bill and David and Susan, everybody has brought up is this COVID-19 community compact. And we put a direct link to it here. This was part of your registration materials when you were signing up for school and filling out like your medical forms and all the different various forms that were necessary for you to be fully registered. This was part of that process. And, you know, I have to tell you, I recently had to look at this myself and just remind myself of what I had pledged to my community. We also have, it's not just the parents and the families making this pledge, but it is also our staff that we ask of this. And I have a personal situation with an elderly mom who's needing to move, and I can't help her because I want to follow this pledge and keep everybody that I work with and all these children safe. So I really implore you really to take a moment and look at the pledge, and especially as we come up to our holiday travel season and wanting to see loved ones, is really look at the travel section because it's so important, especially at a time when we are seeing numbers rising. So please do take a moment and look at the pledge and just remind yourself of the commitment that you've made to the community. And then I just want to go back to this page, and you'll see student illness is listed here, illness during the school day, some of the flow charts that David went through. Can my child come on to campus today? When can my child return to campus? They're all right there for you. The pillars, which I'm sure we all know, but it's always good to just remind ourselves of, you know, how we can stop the spread of COVID-19 and other airborne illnesses. And we also have some resources here for COVID testing. So these are all links to finding a test site near you. And then, you know, we wanted you still to have access to the work that was done to do our reopening plan and the FAQ that we had previously put up. And then if you have any questions, I know it must be very challenging for so many of you to have really not been on campus, like because we don't have parents coming onto campus right now. But this next, the campus maps really lays out all the different entrances and, you know, the temperature taking stations and so many of the plans that we made over the summer to, again, get the community to be able to return to campus safely. So, you know, these resources are there for you. Again, you can find them if you go back to our homepage. This tool, this top bar here is always there, and it just says view here. And, you know, it's a lot. And if you have questions, please ask them. You know, please, we're here to clarify. Our medical team is here to clarify. And, you know, I really feel like we're all in this together, and it's the only way that it's going to work. David, do you have something that you'd like to share to that?
Sure. Yeah, I just want to echo exactly what you're talking about. Like, I hope that resonates with people, and I hope that this presentation has enlightened you or showed you a little bit different perspective of contact tracing. The students are only with us for, unfortunately, 6 hours. I wish they could be with us for more than that. But it's the remaining hours that are really so critical, because the fragility of this whole system is really reliant on the vigilance that you all have on the outside. And really take that into consideration when the opportunities may be out there, that you may be mixing cohorts, or you may be, you know, that's where it really will kind of unravel. You know, I appreciate the privilege of caring for your children and setting up a safe environment. Everyone has done so much. There's so much at stake for a lot of people. Like older, you know, people with older children maybe can tolerate going to work, you know, because their older kids can manage at home. But, you know, the little kids that their immune systems are really fragile, they can't. They're completely dependent on people to care for them, and that may equate to a parent having to change their work environment or have to stop working, or may change their status at the school. So everybody's got a big chunk in it, and I just want to implore you to really consider outside of the school stuff and think about the ramifications. And if people do prompt you for mixing of cohorts, do it in a responsible way, and really kind of be okay with pushing back if there's things that you don't feel comfortable with. It's a natural, innate thing. We want to get together, but it's definitely something, if we don't do it safely, it'll tear it all down.
I did want to briefly share that for the children who started at High Meadow when they were 3 and 4 years old, for them to travel all these years with their group of friends and then be told that they can't be with half their class has been very challenging for our older children. And so after our long winter break, we are going to mix up the cohorts so they can be with some of their other friends, because they'll have been apart long enough for a quarantine. So we did just want to let you know that. And we can't reiterate enough, you see the kind of work that's gone into creating separate heating systems and separate entrances. And all of the things that we're doing at school will be meaningless if it's not consistently followed and the protocols aren't honored when the children leave our campus. So thank you for being part of keeping our school open. And thank you for helping us keep the kids safe.
Bill, do you have anything to add before we go to Q&A?
Yeah, I guess gonna just keep pounding this message in that, being in person was something that we all just came to expect in school. The world's changed, and being in person now is a privilege, and it's a privilege that we really all have to work to maintain. And as Susan said, if we aren't careful, we're going to lose that privilege. I want to sort of have everybody sort of think back about the contact tracing. If we have people mixing cohorts or grade groups or carpooling because they don't feel like going to get their kid and someone else that lives next door, so just grab my child and bring them, that then mixes those cohorts. And then if we start getting positives and it shows up on the contact tracing, it makes it really difficult for us to control. Same with parties.
And then it's not just one small class of 10 kids closing down, then it's every contact and the contacts of the contacts.
Yes, and just like Susan said, then all this work we've done will be for nothing.
Okay, Rachel, can you help us navigate
Yes,
some questions, please?
for sure. We have a couple coming in. So first question, if a family travels to a place on the quarantine list, the travel advisory list, but the child takes a test that is negative upon return, can they go back to school or do they have to quarantine 2 weeks?
That is in the chart.
Yes.
And David, why don't you speak to that? It describes exactly what you're talking about.
Exactly, it does. It's very explicit. You do have to quarantine.
All right, follow up, or not follow up, but next question. There is talk of a post-Thanksgiving break closure. What are the specific triggers for that in terms of local COVID spread? I know we can't know the future, but we can make a plan as to the criterion to make a decision. Have we done that?
Well, the truth is that we're looking at we're thinking about this in a few ways. If enough of our families travel to hotspots or to other countries that are hotspots, and their children all need to quarantine, one way we can look at it is that maybe a third of our school is quarantined, and we teach the children in person, and then the kids who are quarantined are learning remotely. That's one way we can solve that. The other thing we're looking at is the local positivity rates, and there's some assumption that after Thanksgiving, with the way things are surging right now, 40 states have had surges in the last week and record-breaking numbers of cases. It is likely that after the travel and the large group gatherings after Thanksgiving, that the positivity rate will increase so much so that the state will determine, and the health department will determine, that we are closed down for a quarantine. So, you know, we don't have that answer until we really see all the data and we see the way our community decides to celebrate Thanksgiving.
Thank you. So another question, how do you deal with it if a staff member tests positive who is someone who's in many classrooms?
I can answer that. We've taken that into account. And I'll count myself among those, because Carrie and I are the ones that are gophering around. If I were to test positive, that is going to create an issue because we're in different classes multiple times. But we have a protocol for anybody that visits different classes. They're held to a higher standard of personal protective equipment. We all have to wear KN95 masks when we go into the classes. The protocol also stipulates that we have to wash our hands before we go in and wash our hands before we go out. And we track where we are during the day, so that we know what classes we've gone into. But we have done what we can. We have the highest level really of protection that's practical while we're moving around through the classes.
And the other thing that we've done is to minimize the cross-contamination wherever possible. So all of our elective classes, which are typically taught in grades 5 through 8, all but a few on Wednesdays are taught virtually so that we can mix age groups, because we can't mix cohorts in person. And then the Wednesday electives are taught in very, very small groups, typically under 5 children outside. The other thing we've done is if a group is with a teacher who is going to be working with multiple groups, oftentimes our music classes are virtual. Many of our art classes are virtual, with the teacher stays in the classroom and monitors. Our PE classes are taught in a very large space in the Performing Arts Center or outside. So wherever possible, we have made a combination of virtual and in person for any staff that cross over to multiple classes.
All right. Thank you for the info on contact tracing and potential need for moving classrooms to remote for 2 weeks. 2 follow-up questions. 1, would a classroom closure impact both pods for the grade? So like in a 4th through 8th grade class. And also, what happens with all the subject teachers who teach that class?
So the answer to the first question is it won't affect the other cohort, because the way we have it set up, with the first cohort being Monday and Tuesday, and then we have a rest day in between, and then Thursday and Friday. What we would probably do with that, the one connection, of course, are the teachers, that they would need to get tested, but it shouldn't and wouldn't affect the cohort. And what was the second question?
So the follow-up question was, sorry, what happens with the subject teachers? So like in an upper school class, all the teachers who teach that cohort, what happens to them in quarantining?
So they would, if we had a positive in that class, that teacher would need to get tested, and they would have to quarantine for a while. So that class would go remote. And you know, thinking about it, yeah, the cohort would have to go remote too. Both would have to.
All right. If a first grader is sick or waiting for a COVID result, can he join the class remotely online?
Yes.
All right. Thanks so much for all of your efforts to keep our kids and community safe. What is the protocol if a teacher or staff member tests positive?
David, you want that or?
David, you're muted.
Okay, now I can unmute. I couldn't unmute myself. It's really essentially the same procedure. You know, they would get tested. We would find a guest teacher if that was indicated. We would assess the needs of the classroom and get the coverage. That would be more of an administrative thing. So, and then the teacher would get the same kind of procedure, recommend rapid testing or the identification of a chronic pre-existing condition, and then have them come back, 24 hours when symptoms are starting to lessen or have been fever-free for 24 hours.
Rachel, just to clarify, was the question about symptoms or a positive?
It combined the two. Sorry, so for teacher or staff member testing positive.
Testing positive, yeah. So they're the same kind of screens essentially. Those flow charts.
Yeah, like with that contact tracing, those little circles, that could be a student or a staff, the teacher. It doesn't matter. The way the class is treated would be the same.
Yep.
So this is actually a follow-up question from an earlier question. So follow up from the question about the Thanksgiving break closure in terms of how we're determining whether or not we would have to close or go virtual after that break. If the health department doesn't, this does not ask, I'm not sure exactly what that means, but if the health department doesn't ask us to close, do we not close after Thanksgiving break?
Let's say that a large percentage of families decide to travel to hot spots in the country or in the world, and they need to quarantine for 2 weeks afterwards. Then we're counting on our community to be honest with us. And if enough family, we're going to ask people whether we're going to look at the flow chart and we're going to ask them if they were near someone who was infected, whether they traveled to a hot spot, whether they were on a plane, whether they went to Europe. And if we have enough people who answer yes to that it would profoundly affect the quality of education of the remaining children, then the only way we could keep kids from having a huge gap in their education would be for everyone to be taught remotely.
Right. Similarly to how you ask about students traveling to a place with high COVID rates in the questionnaire, have you considered making part of the chart, I'm guessing they mean the questionnaire in the morning, a question asking if you've had a visitor coming from one of these spiking areas? This is something we're sorting through with our family members who live in these areas and want to visit.
Good point.
That's great feedback. We'll make a note of that and continue to explore that.
Yeah, that's also a really important question for us to ask our families.
So a student wanted to ask about the protocol for bathroom usage and hygiene. He told us that he was worried because some kids are not washing hands, and if the kids can go over it in class with the new systems for the sink, etc.
It's hard to answer that without knowing the age of the child.
So this would be a 4th grade.
They had multiple sinks there, both inside and outside the classroom. I'm not sure why that's happening. Maybe the person could, whoever is sharing that question, could email me after the meeting.
All right. Few questions. Are the 15-minute tests more reliable now? There was a lot of news about false negatives with those tests.
David, could you speak to that?
Yeah, I mean, the reliability of these rapid testing kits are definitely in question, but it's the only things that we do have to get things not vapor locked up. But there are newer testing kits that do have a higher reliability and specificity. Yes.
Are the tests that Rosendale, are the tests they're giving, the rapid tests that they give in 15 minutes, Do you know whether what percentage of those are accurate?
I don't know off the top of my head. I do know that Nuvance Health up in the Kingston, old former Kingston Mall, has rapid testing as well now. So I mean, I could reach out, or any parent could reach out to me, and I could give them an updated list of the testing, rapid testing areas. But that is there was a delay in that. That's becoming much more accessible now. You know, 3 weeks ago it wasn't so much. But I could research that and see what's out there, and maybe which is the best, most accurate ones. The PCR testing that I referred to before is much more accurate, but there is a significant, sometimes potentially significant delay, 2 to 7 to 10 days, and that can be significant for their educational footprint.
A good strategy to employ that like many are doing now is to have both done, to get the rapid test and the PCR. So you have
Yes.
a answer.
Yeah, if it's not really very clear cut, or it's a backup, it's a rule out kind of thing with the rapid test, and then the safety nets with the PCR.
Next question. What if a family member has a symptom but not the child? What is the protocol for the kid, including when the kid can come back to school?
The way the contact tracing works, if a parent has symptoms, it's a good idea for everybody in the family to get the test. But if the child is asymptomatic, they can still attend school. That's the second generation. So, I mean, but as they're strongly encouraged to get the test as well.
That
Now,
also
if that parent were to have a positive result, then that family would need to quarantine and the child wouldn't be allowed in school.
So Rachel, we have time for one more question. And if anyone is posing a question that does not get answered, please feel free to send that in an email to nurse@highmeadowschool.org. And if it's not something for them, they know who to share that with so that you get your answer. But if we could just have one more question for the larger group, I just want to respect everyone's time.
Thank you. All right. How might you distinguish the runny nose challenge, illness versus runny nose, because of being inside and outside wearing masks? Meaning, how can you tell the difference between a medical problem and an environment or situational problem?
I imagine David and I will probably both answer to this.
Yeah, go for it.
This is a tough one. There's just
Sure is,
no
yeah.
way, there's just no way around it. David, in fact, was just in consultation. I'll turn it over to him in a moment today about this with the county health department. It's just hard because they're, especially the younger kids, a lot of them have runny noses, and I get a runny nose sometimes when I'm out in the cold. So we're working really hard to try to navigate that one, but it's a tricky one. That's all I can say to that. And David, I don't know if you want to.
Yeah, the only thing I could support, if there's any way you know that your child has a, like historically this season, or this, as the seasons change, or any kind of we call chronic, meaning a very predictable type of symptom, make sure you get that documented somehow, and get that, your doctor can, or your healthcare provider can put that on some paper, and then that actually helps us. It helps give us the evidence to say that this is not an acute problem, but this is something that's they're used to. They know that if there's documented use of antihistamines on a regular basis, just get that kind of put on some kind of a script pad, and that will be helpful for us to produce the evidence for the Department of Health. So
we had a case like that just yesterday.
Yeah.
And the Department of Health accepted the
Yeah, I kind of extended myself to say, I could maybe do an assessment, but they didn't really want that kind of going on, and I can understand that. But we did talk about maybe the availability of rapid testing on site, and they're trying to explore that. There's some laboratory testing waivers and things like that that need to be done. But they're trying to work out having testing availability like in our geographic area, or even at schools, so that we can, get this stuff screened and get them back to class. It's a hard nut to crack. It really is. It's very difficult. And I think their ideas are just to keep it on the side of caution. And that does cause a lot of, ripple effect, but it's safer than just letting it slide.
I want to just take a moment and thank everybody again. Susan, I'll let you say good night to everybody, but part of our Bill announced it that in the morning we have to do reporting for the Department of Health, and that is really contingent on the health screenings being done at home, and people are doing them and people are showing up on time so that the arrival in the morning is well spaced out. And we're all in this together, and we are so appreciative that everybody is really doing the work, because it makes it safe for us all to be on campus again. So Susan, do you want to?
Yeah, I just want to ask you all if you would be willing to participate very quickly. We just want to get sort of an instant survey of who is now thinking that they might be in close contact with people from advisory zones or traveling to advisory zones during the Thanksgiving holiday, just so we can get a sense of what we're up against. Would you be willing to take a quick poll? Rachel can provide that for you.
It's anonymous.
Yeah.
Yeah, it's totally anonymous. Putting together through Zoom, like as we speak, just because it's come up in quite a few questions, and I thought at least we'll get a sense from this group, who is expecting that they might come up against that challenge.
Hey, Rach, it's anonymous, and so it probably only take a couple of minutes. Thank you for your time tonight and for caring about learning how to keep the kids safe.
Okay.
Yeah, I just wanted to reach out too to say thank you for attending, and I'm always available for questions or comments or thoughts. I'd be happy to email day or night, so please do that.
Ditto from me. We're accessible.
All right. So there should be a little pop-up in front of your screen right now, giving a sense of what people are thinking. So thank you. 100% of the current attendees have taken the poll, and 2 people are thinking that they might be traveling to advisory zones or in contact. So out of the 41 people who took the poll, that gives us a sense, at least, of, we can't obviously fully extrapolate that to the entire school, but that is helpful. Thank you so much.
Very helpful, and it's also helpful to know that we have families who are considering that and also being honest. That's all we need.
Yeah.
Thank you. Great.
All right, everybody. Thank you so much. Vote.
Right.
Yes,
Right.
definitely. Please do. Yes.
Please vote.
Thank you.
Doing an
Bye.
honest
Not the
poll.
only poll. All right.
Yeah, the kids, how
Um,
many percentage of kids voted today, Carrie?
We had 95% of our registered High Meadow voters vote in the primary today. It was very, very exciting.
They're doing better than the adults.
Okay, good night, everyone.
Night.
Good night, everyone. Thank you.
All right. Good night.
All right, Bill. I'll see you in the morning.
Yeah, yeah. See you in the morning. Thank
All
you.
right, I'm
Thank
ending
you.
the meeting. Good
Thanks,
night, everybody.
Rachel.
Thank you, Rachel.
Yep.
Thank you, David.